Hello guys, today I have put together a number of tips that will make your HSG experience a more pleasant one. My name is Waliola Boboye. I'm a medical doctor and I'm a reproductive health advocate. You're welcome back to my channel. Quite a number of you might have come across the word or the acronym HSG, and I know there are a lot of people that have never heard that before, but I'm going to let you know what that means. So HSG in itself is an acronym that stands for HysteroSalpingoGram. Big word, but I'm just going to break it down. So it simply is one of those tests you get to do, like if you're having problems conceiving, your doctor may recommend that you have an HSG done. And the main reason why they want to recommend that is to have a look into the womb and also into the fallopian tubes to see if the fallopian tubes are opened up or they are blocked. So the HSG can actually give an insight into that. So it's a very important tool when you're being investigated for the reasons why you're not getting pregnant. It's just one of those things. But if you agree with me, if you get a sample of 100 women and put them together, 100 women that have had HSG, and you put them in a room and ask them about their experiences, there is going to be one experience that is common to every one of them. And they will tell you that HSG is a painful procedure. Take it from me, it is painful. The way we perceive the pain depends on our pain threshold. So that's why people will have different pain experience. But one thing is common is that HSG is painful. And today I have put together a few tips that will help your experience with HSG and make it less painful, thereby making it more pleasant for you. So when you hear HSG, you will not be afraid of going ahead to get your HSG done. These tips I'm sharing with you are simply a product of my experience and learning from the number of patients that I've come across with and have been directly involved in their treatment. So it might not be written somewhere that these are things to do, these are things not to do. It's just simply my experience. So the first tip I'll talk about is asking the question, do I really need an HSG? Is it absolute? Is it compulsory that I get an HSG done? And the only way you can get an answer to this is by getting to see your gynecologist. Your gynecologist is going to ask you a couple of questions, examine you, and then come down to the need for an HSG. So your gynecologist is going to tell you if you absolutely need an HSG or not. Because why do a test that is going to cause you so much pain when you don't even need it in the first place? So the first thing is to know whether you need HSG or not. If you don't need it at this point, abort mission. You don't need to go ahead with an HSG when you don't actually need one. The second tip is this. HSG involves a lot of planning. After your doctor has told you that yes, you absolutely need to get an HSG, then you need to plan for it, because it's not just done abruptly. It is done at a certain day within your menstrual cycle, usually between the 7th and the 12th day. Any day between these days, that is when the HSG is done. My third tip is this. As part of your planning and preparation, you need to also consider transportation. Like HSG causes physical pain, emotional pain sometimes. So you need to be balanced. Book your transport before the procedure and after the procedure. You have a plan to get yourself home to be more comfortable after your HSG. So guys, the fourth tip I'm going to talk about, which I'm going to spend more time talking about it, is the use of medications. Using some medications will help to reduce the pain and the discomfort you get while having an HSG. So in my own experience, like I said earlier, I'm talking about my experience. So I have had to combine some medications to achieve a good balance. Simple pain relievers such as ibuprofen, diclofenac, paracetamol have actually been very helpful. I give some of my patient instructions like use this about 30 minutes before the actual procedure. And in some patients, I actually advise diclofenac suppositories, that one that goes through the anus, also gives a very perfect pain relief. That's for pain relievers. In some patients, I've had reasons to give them buscopan, which actually help to relax the smooth muscles of the fallopian tubes and the womb, and this reduces the spasms they get, thereby causing less pain for them. This has also worked. Remember, this is my experience. And also in a few patients, we've had to go higher with painkillers. This has actually done the trick, done the magic, and I come back telling you how grateful they are for those simple things you've done. So what do you do in this case? Ask your doctor for pain medications. It goes a long way to reduce your pain and discomfort and give you a more pleasant HSG experience. And tip number 5, before you get an HSG, make sure you empty your bladder. I mean, go and pee. The fuller your bladder gets during an HSG, the more uncomfortable the procedure is, the more pain you tend to get. So you don't want to have a full bladder while getting an HSG. Pee everything out. And last but not the least, is actually quite important, which I mean, it could be one of the most important things you will actually want to do, is emotional support. In fact, a lot of people having a loved one beside them during an HSG, holding their hands, gives them a pleasant experience. Just simply having someone that cares in that room goes a long way. Just imagine combining all of these factors together before your HSG experience. I assure you that the HSG is going to go smoothly, more comfortable, and having a very beautiful experience. I hope these tips are going to help 1 or 2 people, and I look forward to reading your comments about how this might have panned out with you. So guys, try this out, share this with your friends, and drop your comments in the comment section. And I hope to hear from you as soon as possible. Have a pleasant HSG experience.